Hi students, I'm Dr. Aditya Tiwari and I'm trying to cover another very important concepts in psychiatry about eating disorders. In the previous video, I've already talked about anorexia nervosa, but in this video, I'll be talking about the rest like bulimia nervosa, binge eating behaviors, and pica. So let's move ahead. Uh, I'm sure this presentation will be very essential for both the medical and nursing students for their examination point of view. I'm trying to cover most of the important topics here, okay? So we know these eating disorders are very much common in American population across all the demographics, okay? So we often see this type of questions in the examinations. So when we go through compare anorexia nervosa with bulimia nervosa, we have to always remember that anorexia nervosa patients, they were low weight patients, they had very low BMI, but in bulimia nervosa the BMI may be normal or slightly elevated. So now just by the presentation in the hospital, in your OPD or in your clinical settings, you won't be able to distinguish a person if he has bulimia nervosa or no, because he may have normal or slightly over it elevated BMI. And so that's one of the major differences here. And now talking about the diagnostic criteria in bulimia nervosa, it's like the person here, it's large amount of food items in discrete period of time, and they cannot control themselves, so they keep on eating a large amount of food materials in certain interval of time. So and they do and eat every day. So but at the same time they have a feeling that, oh, I'm eating too much. So based on that feeling, now they do the compensatory behaviors like vomiting, use of laxatives or diuretics just to prevent weight gain. However, and they try to do this, and the frequency and duration will be like they will do this at least weekly for 3 consecutive months, okay? So if they started it from January 1, so January, February, March, all these months, 3 months, at least each week. So they have to do this at least each week in 3 consecutive months. And if this criteria is maintained in 3 consecutive months in each of the weeks, if the person eats large amount of food in certain period of the time without the sense of control, and to compensate that, if they keep on doing compensatory behaviors, then we categorize them as bulimia nervosa. And just we have to be sure that the person has normal or slightly elevated BMI. So here in anorexia nervosa, all these criteria may be met, but the person has low BMI. Whereas now the next topic we'll be studying will be binge eating behavior. In this, the person eats large amount of food, okay, in discrete period of time, but they do not have any compensatory behaviors. So we have to understand here differences between bulimia nervosa and anorexia nervosa, basically based on BMI, and bulimia nervosa and binge eating behavior, basically because there won't be any compensatory behaviors in binge eating behavior, okay? So when we go through bulimia nervosa, these patients have parotid hypertrophy. So because of the repeated vomiting, they put the hands inside the mouth and vomit, so there will be excessive of parotid gland or this salivary gland activation, and that leads to parotid hypertrophy. And when the parotid gland is becomes hypertrophied, and there will be increased production of the increased secretion, and at the same time that serum amylase level may rise up. So sometimes in questions they may give this hint, serum amylase level increased, okay? Then we try to understand, okay, it's something like person has some eating disorders and they are doing to inducing vomiting, so that's why it's hinting us towards eating disorders. And because of the repeated vomiting, the gastric acid comes to the mouth, so because of that there will be the dental erosion, enamel erosion in the teeth. And similarly there will be the Russell sign positive. So Russell sign is like when the people put the fingers inside the mouth and try to vomit, at these knuckles there will be the scars or calluses in the knuckles, and this sign is called as Russell signs. Always remember, Russell sign is more common in bulimia nervosa than in anorexia nervosa. Now metabolic complications. What happens if the person is has bulimia nervosa? In that case, since the person will be repeatedly vomiting, so there will be hypokalemia because when the person will be vomiting, there will be fluid loss, and there the RAS system gets activated. RAS system, sodium gets absorbed, potassium gets secreted, so hence hypokalemia. And since the acid is coming out of the body, so hypochloremia. And since again acid is coming out of the body, so we say it metabolic alkalosis. So these electrolyte abnormalities will be there, and since there is electrolytes abnormalities, so there is always the chances of cardiac arrhythmias and muscle arrhythmias. And sometimes also the person will try to vomit and forcefully vomiting. The distal part of the esophagus, near the esophageal gastric junction, the mucosa may get tear up and the blood may come out, and that condition is called as Mallory-Weiss syndrome. So this can also occur. So now how do we manage this condition? So basically we have to counsel these patients, okay, that you have to maintain your nutrition pattern, you have to eat normalize, you have to eat your food in a pattern. So that's why you don't eat too much in a certain period of time, and you get frustrated and you start vomiting. Don't do that. So nutritional rehabilitation counseling will be there, cognitive behavioral therapy must be there, and at the same time if needed, pharmacological support may be needed. That's we give it. I start with SSRI, and fluoxetine is an example of SSRI. Now since the person is vomiting, there is electrolyte imbalance. So again, bupropion, this is a antidepressant. We don't give this in case of bulimia nervosa also, because there will be increased seizure rates. Now we completed bulimia nervosa. We have already learned about anorexia nervosa. Now binge eating disorder, it's more or less like bulimia nervosa, but here there will not be any compensatory behaviors. Okay, so again the most common eating disorders, so it's again the most common eating disorders because a lot of people eat a large amount of food in certain intervals, and that do on a recurring basis, and they don't do compensatory forcing behaviors. Okay, so to meet the criteria, they must do this again weekly for at least 3 months, and there won't be compensatory behaviors like vomiting, like using of laxatives or diuretics. Okay, and again in binge eating disorder, person has an insight, so that's why the person may get distressed, and obviously when the person is too much, then there is chances of obesity and metabolic complications. That's increased diabetic risks. Okay, and the person often has a comorbid depression, anxiety, and now since they are gaining weight, then they also feel a little ashamed. So yeah, so it's a mixture of everything. So this photo, the person has large amount of food items, and is at the same time there is psychiatric manifestations like is sad. Yeah, so it is associated with mental health disorders like depression, anxiety. So this photo tries to explain that. Now how do we manage binge eating disorders? Again, first line therapy in case of binge eating disorder is psychotherapy, cognitive behavioral therapy, and interpersonal therapy, and pharmacologically SSRIs and lisdexamfetamine. This drug we use in binge eating disorders, whereas in bulimia nervosa we'll try to go with SSRI only, but in binge eating disorder we can also use lisdexamfetamine. Okay, and yes, it will always be multidisciplinary approach with psychiatrist, psychologist, dietitian, and yes, general physician. Everyone must be there. Now the last topic is Pica. So we all know that Pica, it's more common in pregnant women and some children, and the person with developmental disabilities and history of emotional trauma. And in this case, Pica, the person, they eat those things that are not usually edible. Like example, they tend to eat eyes, we call it pagophagia, and similarly dirt, hair, paint chips. Okay, these paint chips is it's commonly seen in examinations. So if the person is eating paint chips, you can think about Pica. And Yeah, I mean the scenario must be hinting towards eating disorders too. And yes, when the person with the pica, they eat these things that are non-nutritional things, and they feel the temporarily emotional relief on eating these things. Okay, so they tend to eat this, and yes, since they are eating non-nutritious food, they means children, pregnant women, people with emotional disabilities and developmental disabilities and emotional trauma. So they come to develop malnutrition, dental damages, sometimes gastrointestinal obstructions on taking those hairs. Sometimes they take toxic things, so there will be toxic ingestion rates, and this condition is also associated with iron deficiency anemia. So to make a clinical definition with this, the person must be eating these foods for more than 1 month. Okay, and this must not be culturally or developmentally an appropriate behavior for that individual. And the treatment is always psychotherapy, nutritional rehabilitation. These two must be the frontline management plan, where the counseling will be done, nutritional rehabilitation will be done. If there is iron deficiency, try to manage that, and at the same time, in the second line, we go with SSRIs. So yes, in the key clinical takeaways in this is that we already read about anorexia nervosa, we read about bulimia nervosa, binge eating behavior, and pica. All these things require early diagnosis and multidisciplinary treatment approach, and also we must always monitor the patients because there will be always chance of electrolyte imbalances, cardiovascular risks, and so we don't want to lose the patients. Okay, yes, and with this we in this topic, I would like to thank you for your attention, and please share this with your colleagues and continue following this channel for more evidence-based medical topics. And I'll try to cover most of the topics that will be holistic in terms of preparation for competitive examinations for both the nurses and the doctors. So please go through this. Thank you so much. See you in next video. And if you haven't studied yet anorexia nervosa, please read that by searching in the channel. Bye. See you in next video.